One thing that I see often is pain that is in the face, right? So behind the eye, behind the bridge of the nose, or potentially behind the cheek. A lot of times they can be coming from the neck. So they can be coming from the occipital nerve or the cervical facets in the cervical spine. And if there's arthritis or inflammation or irritation of those nerves, they can potentially lead to pain not only in this region, but they can actually refer pain to the front. That's because of what we call the trigeminal cervical complex. This is the greater occipital nerve, right, which is coming from the cervical spine, from the C2 and C3 region, right? And then these are the trigeminal branches, V1, V2, and V3, which are obviously innervating the face. And as you can see, they both land in the same part of the brainstem and the spinal cord. Because of that, you can have the phenomenon of referred pain, where you have nerve inputs. So the nerve fibers are basically landing on the same spot inside the brainstem, and that can fool the brain into thinking that the pain is coming from one region when it's actually another. Think about somebody having a heart attack. A lot of times they might have left arm pain, right? Now, obviously, the arm is fine in that case. The brain can't really distinguish the two. So if you're having a heart attack, it might assume that the pain is coming from the arm. So you might be fooled into thinking that your arm is actually a pain generator when it's only your heart, right? So we call that referred pain, right? Another example of that is when people have gallbladder issues, that can lead to referred pain in the right shoulder.